Hi, it's Dr. Carolyn Ross. I'm going to continue to talk about intergenerational trauma today. And I talked to you about my family history, my family's chart being riddled with episodes of trauma and the effects of trauma, including suicide, depression, anxiety, eating disorders, and substance use disorders. So one of the things that I found out is that intergenerational trauma isn't just due to the environment, like your mother doesn't take care of you, but we know that in those studies on offspring of Holocaust survivors, there's an actual biochemical change in the genes that take care of stress. So those genes can be turned on, which we call epigenetics, where it's not a change in your gene itself, it's a change in the expression of a gene, so that the gene for, say, substance use disorders can be turned on. And then that altered gene is then passed on to the next generation. We know that, grandchildren and great-grandchildren of formerly enslaved individuals have higher risk for all of the major medical problems and mental health and behavioral problems than do those who have never been in slavery. These prolonged stresses related to slavery have caused higher rates, for example, of high blood pressure, some psychological traits such as a sense of a foreshortened future, like you don't feel you're going to live very long, and also anger issues, lack of trust, and so much more. So again, this intergenerational transmission of the effects of trauma have an effect on the stress response system. And that's thought to be due to epigenetics, turning on that gene. And then how it shows up is people who are extra sensitive to stress, or people who are on red alert all the time and don't ever seem to be able to calm down. Growing up in a family where there was trauma, my self-esteem suffered, and I also struggled with trust issues and a lot with negative self-talk. And self-doubt kept me from achieving what I think would have been my full potential. But one of the skills that I found very useful was changing my own internal dialogue. And I did that by imagining all of the voices that were saying, you're not good enough, or you're not lovable, or you're not worthy, or something's wrong with you. I imagined those as individual people, a lot of them my mother, who used to be verbally abusive to all of us children by calling us stupid, idiotic, lame brain. So I imagined my mother and all these other voices in the back of a truck, and then I imagined backing that truck up to the edge of a cliff and literally dumping all of that negativity down the cliff. Okay, that may seem a little bit harsh to some of you, but it really helped me because I was taking a firm stand that I was no longer going to be the victim of negative internal dialogue. So to be successful at breaking the cycle in this way, I realized I also had to stop, my own shaming of myself and blaming myself, and also that self-doubt. This wasn't easy. So again, I practiced that over and over and over until I found that constant negative self-talk had quieted and was much, much less frequent. And this was part of my journey that happened, very early on. If you haven't done anything like that, if you're the victim of, the voice from a parent growing up calling you names, or the internal voice that you've internalized shaming or blaming you, then I really encourage you to find your own image that you can constantly use to interrupt that negative self-talk. You may not want to be as violent as I was with backing the truck up to the cliff, but find a different image, but your success will depend on staying vigilant and practicing this over and over and over.